It is 8:13, time for our segment on, well, usually senior health, but it's not really. This applies to everybody. Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, joins us. It's Diabetes Awareness Month, and according to the American Diabetes Association, over 500,000 adults in Louisiana alone have diagnosed diabetes. So, Dr. B, welcome in. And this really is not just a senior topic, is it?
Absolutely, Tommy. This really affects so many people in Louisiana, so it's a very important topic.
Tell us, what is diabetes?
Sure. So, diabetes is a chronic health condition, that many people have. What it does is it actually affects how your body turns food into energy. So, kind of made simple, your body breaks down whatever you eat into sugar or glucose, and then it releases it into your bloodstream. And then your body has to kind of absorb that blood sugar into the cells so that it can be used. Well, in order to get it into the cells, you have to have insulin in your body. Insulin is released from your pancreas, and it acts like the key to sort of open the door and allow that sugar to go in and then be used as energy. And so what happens in diabetes is your body either doesn't make enough insulin or it can't properly use the insulin that it is making. So, that can be because the cells actually are not responding to the insulin. Too much blood sugar stays in your bloodstream, and then over time, those high blood sugar levels cause all kinds of serious health problems. In particular, heart disease, vision loss, and kidney disease are really, a couple of the major ones.
What are the main types? Are there different types of diabetes? More than two? What?
Yeah, there definitely are. And then there's really two main types, type 1 and type 2, so pretty simple. Type 1, which is less common, is actually caused really by an autoimmune reaction where your body attacks the pancreas cells that are making that insulin. And when it attacks them, they can no longer make the insulin. So people with type 1 diabetes absolutely have to take insulin really to survive. Type 2 diabetes, which is much more common, about 90% of people have type 2 diabetes, those individuals still produce insulin. And actually, often they produce really large amounts of insulin. The problem is your body can't properly use it. That's something we call insulin resistance. So your body is really resistant to using the insulin, and that's why you have to take sometimes other medications in order to help.
What are some of the symptoms of diabetes?
So, unfortunately, sometimes there are no symptoms at all, but when there are, usually people describe kind of increased fatigue, not having as much energy. Some people will develop weight loss and really rapid weight loss at times when they're not trying to lose any weight.
Really? I didn't know that. Weight loss?
Yeah. If you're not able to use those sugars, your body reacts in a way where it ramps up your metabolism, and so you can really drop weight pretty dramatically. Okay. And one of the most common things that people will describe is actually vision changes. So, maybe a change in the prescription for your glasses. That's something that always needs to get checked out. And then in particular, in excessive thirst or hunger. So people actually, when the blood sugar gets high, your body can't use all that sugar, so it thinks it needs more. And so you can get very hungry or very thirsty. And then, in particular, people can develop nerve problems, so tingling and numbness in the hands and feet. Often that's one of the first symptoms as well. And, the one thing to think about with type 1 diabetes, even though it's less often, those symptoms really come on very suddenly, whereas with type 2 diabetes, they're extremely gradual, and people may not really recognize them. So that's why it's so important to be talking to your primary care physician about anything that's going on with you, and maybe ask them about getting your blood sugar tested if you have any of these.
What are the risk factors for diabetes? Because you certainly don't want it.
Yeah, absolutely not. So for type 2 diabetes, the risk factors are pretty clear. It increases with age, in particular people that are 45 or older. It definitely runs in families. So if you've got mom, dad, brothers, and sisters with diabetes, you're more likely to develop it. And then it is very related to weight. So people that are overweight or really live a sedentary lifestyle, they don't do a whole lot of exercise, they're going to have a higher risk. And then anyone who has pre-diabetes is at risk risk for going on to develop full diabetes. And then, for type 1, the risk factors are a little less clear. We do know that it can run in families, but the exact cause of it is not as clear to us, so there's still a lot of research going on. But that one tends to appear younger in life, so usually children or even teens usually are the ones who get type 1 diabetes.
So wait, what is prediabetes?
Yeah, so prediabetes is actually when your blood sugar levels are higher than normal, but they're lower than what we usually see in diabetes. And prediabetes is actually, it's really important because it is curable while diabetes is really only treatable. So if your doctor determines that you have prediabetes, then it means you're at higher than average risk for going on to develop full diabetes, but there are things you can do to prevent progressing to the full disease.
What about finding out? How do you get screened for this?
Yeah, there's easy screening tests for prediabetes and for diabetes. There's simple blood tests that we can do. The results come back sometimes even immediately when you're in clinic, or they're sent out and you get them back the next day. And really what I tell people, anyone, really any age, anyone who is overweight or obese, and has at least one of those risk factors that we were talking about, we should screen you. And then really for the entire population, at age 35, you should get screened at least once, and then usually we'll screen you about every 3 years after that. Because, again, we want to identify the disease early so that we can get you into a treatment plan, and if it's prediabetes, hopefully we can get you cured completely.
All righty, we'll take a break. It's 8:20. We're talking to Dr. B, our friend Dr. Brent Wallis, Chief Medical Officer over at People's Health. It's Diabetes Awareness Month. According to the American Diabetes Association, over 500,000 adults in Louisiana alone have diagnosed diabetes. You certainly do not want to get this, and treat it if you have it. If you have any questions, 504-260-1870. I'll try to get to them when we come back. Right now, it's time for traffic on WWL. 826, Tommy Tucker, WWL. Quickly, background to Dr. Brent Wallis, Dr. B, Chief Medical Officer at People's Health. Talking about diabetes. Doc, what are the treatment options for diabetes?
Yeah, Tommy, the good news is we have a lot of treatment options. So if you are diagnosed, then your doctor is going to talk to you about what your plan is going to be, and it's really multifaceted. So for type 1 and 2, you absolutely have to monitor your blood sugar, and that's going to include checking it when you're fasting, usually first thing in the morning, and then after meals, because that'll give you a good indication of whether or not you're eating healthy. And that's really kind of the second thing, is having a really healthy diet, avoiding a lot of those processed sugars and fats. That's going to help lower your blood sugar as well. And then exercise is key, really staying, at a healthy weight, exercising regularly. That's really going to help to keep your sugars in control. And then, the difference between type 1 and 2, type 1, like I mentioned, you absolutely have to use insulin. Type 2, you may require insulin depending on the severity of your diabetes, but we have a whole host of other medications that can be used to get your blood sugars down. So it's going to be very individualized, but if you follow the regimen, you'll avoid a lot of those serious complications like heart disease, kidney disease, and all the nerve damage.
I don't have it, and I sure as heck don't want it, so how can we lower our risk for diabetes?
Yeah, there are definitely some things you can do to try to avoid diabetes, and it's really simple lifestyle changes in particular. I mentioned really being more active, and there's a very specific reason for that. If you're actually more physically active, it actually reduces that insulin resistance that I was talking about. So it makes your body more sensitive to the insulin that is already in your blood. And so it's key to stay active, lose weight, make sure that you're, having a healthy diet. Those are really the biggest things that you can do. So when it comes to exercise, I tell people 30 minutes a day, every single day of the week if you can. And it doesn't have to be super vigorous. It can be walking or biking. Just getting out and being active. Don't sit on the couch and watch TV all day. That's going to actually make things worse.
And you got to carve out the time. It's important to your health, so just like you have a busy schedule, put that 30 minutes on your schedule and just make sure you do it. How else can you lower your risk, Doc?
Yeah, I mean, I mentioned diet, and diet is really, really key. Making sure that you're eating healthy foods. You want to really look at the fats that you're eating and try to swap some of them out for more healthy types of fats. So things like salmon, avocados, almonds, olive oil, those are all going to be better than a lot of those animal fats. And then in particular, increasing your intake of grain products as opposed to carbohydrates. Things like white bread and white rice, you want to go with, the less processed foods. Like a whole grain rice is going to be better than a white rice. And again, it's all moderation, so you don't have to completely eliminate everything, but you definitely want to moderate a little bit. Absolutely, do not drink soft drinks. Sugary drinks really have just a tremendous amount of sugar in them. You want to swap out something like water or iced tea. You want to really kind of go with leaner meats, chicken, fish, as opposed to a lot of red meat. And then you can substitute skim milk or one of the milk alternatives for whole milk because they're going to have a lot less fat in them as well.
I don't know who developed sweet tea, but it's like syrup, and they ought to take it off the market. That's just my opinion. Doc, one thing we've not mentioned, and we only have a couple of seconds left, is the pain that is associated with neuropathy, because I've known people that have suffered, and that in and of itself is a reason to avoid this.
Absolutely. It can be very, very difficult to deal with, and luckily we have medicines, but keep in mind if you get your blood sugars down, your neuropathy is going to get better as well.
Thank you, Doc. I appreciate your time. Have a good weekend, all right?
Thanks, Tommy. You too.
You bet. To find out more about People's Health, you can always go to peopleshealth.com. You can visit the People's Health Medicare Center. We were there. It's beautiful. 3017 Vets in Metairie next to Party City. Appointments are recommended, but walk-ins are welcome. You'll be impressed, and they'll walk you through the whole Medicare process, as a matter of fact. Even if you don't want to sign up for People's Health, they just want you to know what's going on. You can call 1-800-978-9765, and you can follow People's Health on Facebook, Twitter, and Instagram. A little bit